Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Simon, a 39-year-old gentleman, has recently decided he wants to quit smoking. He initially started smoking at the age of 13 when a friend encouraged him to try a puff. This was after school, and he started concealing his smoking habit from his parents, who neither smoked nor drank alcohol. Simon continued smoking into his 20s when smoking then increased as work challenges also increased. Simon found that smoking became a habit, but also it was the main and only tool that he had for stress alleviation. Over the years, Simon has tried to quit. He has tried to quit multiple times, in fact, because his friends have recommended it, his girlfriend has recommended it, and his doctor encourages him to quit smoking every time he goes in for his asthma checkup. However, over the years, each time Simon tried to quit, something would happen in his life. Something such as a change in work situation, a change in manager, a need to move home, financial stress, and he would find himself going back to the cigarettes because they were his one stress coping mechanism. Simon now has decided to try to stop smoking and go cold turkey. He has taken some time from work to be able to have a few weeks where he doesn't smoke any cigarettes and so that he can return a smoking free person. However, Simon wants to know, he has been smoking now for over 2 decades. What does this mean for his health? Is the damage already done? Simon has been increasingly anxious about this because his grandfather was recently diagnosed with bowel cancer. And although he used to be an ex smoker, the doctor mentioned that it could potentially have had implication. Simon wants to know, is it even worth it? If his grandfather stopped smoking and still got cancer, is there any point in him smoking? Is there any point in him stopping smoking? So, today we're going to be talking about lung cancer and the risks associated with it, especially in relation to smoking. As we enter the month of August, we celebrate awareness of lung cancer. Lung cancer is the leading cause of cancer-related death around the world, according to the WHO. This means that it causes the highest number of cancer-caused deaths in both men and women. It is also mostly related to smoking in around 85% of cases where lung cancer has been diagnosed. The most important fact for preventing lung cancer is reducing exposure to tobacco. That means smoking, but also exposure to persons that smoke, which is what we refer to as passive smoking. Cancer happens when cells in the body start to grow in an abnormal way or in an uncontrolled way. And as these cells continue to grow, they start to spread and they can cause harm and they can also cause death. Some of the common signs and symptoms of lung cancer are things like shortness of breath, coughing of blood, loss of weight, increasing tiredness, chest infections that keep coming back, chest pain, and a cough that just cannot seem to shift. Now, although we've referred to smoking, tobacco, and exposure to tobacco as one of the most important ways to prevent lung cancer, other things that can cause lung cancer include air pollution, workplace hazards such as inhalation of certain fumes from chemicals, and also exposure to asbestos, which is known to cause a specific lung cancer that is called mesothelioma. Now, Simon wants to know how stopping smoking can reduce his risk of lung cancer and if it's actually worth it. One of the first things that we would say to someone like Simon is that it's absolutely worth it. Lung cancer is not the only cancer that is caused by smoking. Other cancers include bladder cancer, cancer of the throat, cancer of the kidneys, cancer of the mouth. So there are lots of different cancers that are related to smoking. In terms of Simon's specific question, immediately he stopped smoking, we noticed that the risk of lung cancer starts to reduce. Within 5 years of him stopping smoking, that number drops significantly. And by year 10 to 15, the risk of him developing lung cancer almost halves compared to those that are current smokers. And once he gets past the 20-year mark, in many people, their risk starts to approach that of someone who actually never smoked. So, stopping smoking can reduce the risk of him having lung cancer by at least half, and in some situations, it can get up to 80%. So, what are the other things about lung cancer that we need to be aware of? If someone was to ask you, oh, well, what do you know about lung cancer? Those are the main things that we've referred to as well. Now, there are other questions that we might ask when it relates to cancer. What about family history? Family history does play a significant role in most health conditions, and having a family history of lung cancer does contribute to likelihood of disease. However, having a family history of lung cancer and being a smoker does significantly increase the risk. Vaping is something that we should also mention and discuss. Vaping has a combination of different mists and flavors that can be inhaled through something called a vape. Now, vaping is actually still really new, and the long term side effects have not been studied because we've not had an opportunity to observe people who have vaped or been exposed to vapes for a long and prolonged period of time. However, what we do know is that the combination of the different mists that come into a vape and go into the lungs can have the potential to cause lung damage. So what we recommend is that there is an avoidance of smoking, tobacco, and an avoidance of vaping to simply protect lung health. So if someone had any of those symptoms that we referred to earlier, the first step would be to speak to their doctor and list the symptoms that they're experiencing. And then it would be expected that they would have some investigations that might be blood tests and scans or x rays that would help identify what might be going on. X-rays are always a good place to start as they can see a good amount of information of what is happening in the lungs. However, there are more sensitive tests that are able to pick up things like tumors in the lungs, especially in early stages as well. Treatment of lung cancer can be varied, and this could be surgical treatment, this could be chemotherapy treatment, this could also be something called radiation therapy or radiofrequency ablation as well. And there are newer treatments available, things that we call targeted drug therapy or immunotherapy. These are drugs that are made specifically to attack and to protect the immune system so that a person's own body can fight cancer. Immunotherapy is a specific kind of treatment that helps one's own immune system start to fight off cancer. So, there we have it today. Smoking cessation, stopping smoking, has a significant impact on lung cancer, but also the risk of cancer starts to significantly reduce the longer you stay away from smoking, cigarettes, and tobacco. That's it from me for today. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now. Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And don't forget to be a health champion wherever you are by separating health fact from health fiction.